Hi, my name is Andy. I'm recently just finished my MD PhD degree at the University of Toronto, and I'm presenting some work with a clinical group studying MPNs at Princess Margaret Hospital in Toronto, Canada. Uh, and I'm going to back up a little bit and talk about myeloproliferative neoplasms, MPNs. It's a type of blood cancer caused by overgrowth of certain types of blood cells. Broadly speaking, we can think of overgrowth of red blood cells or too many platelets. And here we're focusing on a type of MPN called myelofibrosis. This is characterized primarily by scarring or fibrosis in the bone marrow, interrupting blood development. Myelofibrosis is what we call a really heterogeneous disease. Some patients do very well, and they can be followed for many, many years, and others may have very severe disease that progresses and transforms into frank leukemia, and these patients sadly pass away quite quickly. We've been trying to understand what makes some diseases, some cases of myelofibrosis more severe than others. And a lot of work that's been done over the last decade or two has shown that genetic mutations can impact disease biology. It can make some diseases worse. It can make some diseases more likely to transform into AML, acute leukemia. And so what we've been studying is kind of the next layer of biology, if you will. There are cases that genetics can't explain, where the genetics can be the same, but the outcomes can be quite different. And so we're looking at something called the transcriptome. This is looking at RNA, so genes that are being expressed at the RNA level in these cancer cells of these patients. And we're looking at differences in which genes are being expressed in this sample and which genes are being expressed in this patient sample. And we're trying to understand whether that can help inform our understanding of why some patients do very well and some do very poorly, beyond what we know from genetics alone. And so at Princess Margaret Hospital, we generated a cohort of 526 patients with myelofibrosis, where we tracked their outcomes. They were all treated in Toronto. And we performed something called RNA sequencing, measuring the levels of RNA of over 20,000 genes for every patient sample. And we asked broadly, are there some samples that are more alike than others? And so we performed an approach called clustering of the RNA, where we found groups of patients that were very similar in terms of their RNA profiles. We found 4 of these groups, which we call our subtypes of myelofibrosis. These 4 groups we found had stark differences in survival outcomes. Some patients, one group did much better than the others, one group did much worse. They reflected differences in biology in terms of how blood development goes wrong in this disease. And there's a lot of really interesting avenues where we can start to think about therapeutics and different ways to target these different subgroups. But we also see differences in transformation to leukemia. So 2 of these groups in particular have a very high risk, around 30%, of progressing to acute leukemia within the next 5 years. And the other 2 subgroups have a low risk. It's around 5%. So we're starting to see separation in terms of the outcomes of these subgroups. And what we're really excited about is that we're seeing different types of biology in myelofibrosis. There are new therapies that are coming out that are targeting different molecular pathways and mechanisms. And we see that a lot of the times those new therapies have response rates that are not 100%. They're maybe 20 to 40%. And so we're hoping that some of the biology we're seeing in these patient subgroups can help to explain the variation in outcomes and responses to these new therapies that are coming out. So it's an exciting time, and we're really looking forward to seeing how this will play out over the next few years and explain biology and clinical outcomes.